Happy Wednesday, December 27th. It's me, Mary Coughlin, president and founder of Caring Essentials. And I know yesterday I said I was going to do some really cool locations around Boston, but it is just too darn cold. And waiting around all day for it to get a little bit warmer was probably not my best strategy. Right now it's 18 degrees Fahrenheit, which is apparently -8 or something Celsius. So it is a wee bit nippy. So I've abandoned this idea just until it warms up. Okay, so stay tuned. We'll be doing some cool sites, but right now we're just overlooking Ashmont Street from my office, and the topic for today is about compassion. I'm approaching this idea of the articles in review a little bit differently. As I was reviewing articles and really trying to come up with a subject that was interesting to me and I feel really relevant for you guys, I discovered that the solutions that we're seeking aren't really going to be found in a single publication, right? I mean, it's really a composite or a reflection on a variety of different inputs from researchers, from philosophers, from all these multidisciplinary experts that will inform us, and hopefully with that information inspire us to transform the way we provide care to others and even to ourselves. And so when I reflected back on yesterday's article from Flacking, looking at how to support, or what are those things that help parents feel emotionally connected to their infant, I started thinking about, so why is this not happening? Anyone knows that a parent wants to be close to their baby, and when their baby's in trouble or sick, I mean, obviously the parent wants to be there. So what is the real issue? And I thought, well, what if it's compassion? What if we are just so overwhelmed with all these competing priorities? Some of us are maybe a little burnt out, have a little compassion fatigue. Maybe that's the issue. And so I went on my lit search and started looking at a variety of different publications that have analyzed, done systematic reviews, posted editorials and that sort of thing on the subject of compassion. And what I will do for you guys is I will give you a list of the references that I've gleaned and the links to these different papers. But they were all really quite interesting. From one author who did a really amazing editorial looking at what money can't buy, and really identifying that compassion and compassionate care was one of the things that money can't buy in healthcare, that there's lots of barriers to professionals providing consistent, compassionate care. And then it's not just a clinician issue, right? We all are compassionate. I see you guys. I see you providing care. I see you providing that empathic support to the parent who's devastated about a turn in their baby's clinical condition, or even worse. I've seen you gently reposition the babies, or really thoughtfully try and understand and empathize with the parent's lived experience. So I know we are compassionate, but what is it that challenges us to be that person every single time? And actually, there were several papers that looked at what they described as barriers and enablers to compassionate care. And certainly, one piece of it is how professionals across all disciplines are accultured into or socialized into their practice. That's certainly one factor. How we're all educated. I can remember my nursing education was, we really didn't talk about compassionate care. It was really assumed. It was, that's, of course, you're going to be compassionate, without any very clear definition of what is compassionate care, what does it look like, what are the behaviors and actions that exemplify that value. And what several of the authors that I've looked at really talk about is some of that ambiguity around what is compassionate care. And this one very interesting paper was not the what money can buy, but how does it really feel to be in my shoes? And it was talking about a patient's experience and how patients are very tuned into what feels like authentic care or compassionate care, and what doesn't feel like authentic compassionate care. And so we need to really try and find out what is compassionate care for ourselves. There was one paper that really talked about the origins of our ability to deliver compassionate care really is an outgrowth of our ability to care for ourselves in meaningful, mindful ways. I kind of make a joke, when I do my talks and I mention this challenge that we face around compassionate fatigue, that self-care isn't pouring yourself a glass of Cabernet and plopping down on the couch to watch the last Ellen, shooting, program or whatever. I apologize. That's not what compassionate care is for self. That self-care is much more than that. It's being mindful. It's being reflective. It's honoring yourself and honoring the uniqueness of yourself that you bring to the clinical encounter. And then by honoring that and acknowledging it, you nurture it. And then it allows you, when you acknowledge that, to cultivate courage, right? And consistency in doing that, because a lot of our behaviors may be squelched by the culture in which we work in, right? Peer pressure, people minimizing the importance of being compassionate. I know some of my colleagues would joke about how emotional I would get when I would come back from the delivery room, that it was just such an overwhelming honor for me to bear witness to another human being coming into the world. I would be often overwhelmed by the experience, and yeah, I'd be a little bit tearful. And then I'd have to bring that little person up to the newborn intensive care unit for a septic workup. And I was so overcome by the joy and the privilege of bearing witness that it would show on my face. But that wasn't the culture in our unit, right? We're tough, we're adrenaline junkies, and we get the job done, and we're technically proficient, and we have amazing clinical prowess, which is wonderful and important, and I'm not dismissing that. But it shouldn't be antithetical to having a compassionate heart, being empathic with others, having that authentic human presence that says, boy, this is really tough, and I am so grateful that you've shared your vulnerability with me. Let me help you. Let me walk with you. And for our tiny patients in the NICU that are unable to express many of these feelings that they may be having verbally, to intuit with them, to recognize that this is a drag no matter what age you are, and honor that and respond appropriately. And that's really what compassionate care is about. But again, those barriers are not just your peers, not just your inability to nurture yourself, but it's what does the organization do? How does the organization exemplify a compassionate milieu, a compassionate culture? Are you valued for the work that you do? Are you valued for the contribution that you bring to the patient's experience? The one article that was really intense, this one about what money can't buy, made a lot of references to challenges that the NHS in the UK faced around compassionate care, where the feeling from the editorial was that the heads of state and those high ups in the health system, gave a lot of lip service around compassionate care. But what their actions demonstrated was a bigger interest in budget, maintenance, and that sort of thing. So even though they talked the talk, they didn't walk the walk. And when you're a clinician working in that environment where, you're getting staffing cuts and budget cuts and all this other kind of stuff, it makes a statement about what the organization's commitment is to compassionate care. So several of these papers that I'm going to share with you, they talk about some of those organizational challenges, the patient's perspective, and certainly what are those enablers and what are those barriers that we face in trying to consistently and reliably provide this. And truth be told, those are not the only barriers. That sometimes we just deal with difficult folks, that anybody put into a crisis situation may very well, be kind of pissed off about it and have a bit of an attitude about it. And how do we overcome that and get to the core of that? And you know what? Some folks, you just don't get along with everybody. But in your role as a professional healthcare provider, whatever discipline, you have to portray and exemplify what it is that they need in that moment. Do they need understanding? Do they need some tough love? Do they need a referral? And not just to, pass the buck kind of thing, but a genuine examination of what are their needs in that moment. That's compassionate, honoring where they are. Maybe this is the first time, some of these parents have interacted with the healthcare system. And so they may actually have some occult medical or mental health challenges that become manifest in the setting of a crisis. So really, the solution that presents itself, and it's not a simple solution, obviously, but it provides us with an opportunity to have some dialogue with our peers, with our higher ups, with the organization management and that sort of thing, to say, look, we are completely committed to supporting these individuals in crisis. We get it. And we need to come up with a solution that isn't one size fits all, but is responsive, is individualized, is patient and family centered, to really get to the core of how we can best serve these individuals in crisis. And trust me, when you are able to do that, or at least get on the journey, it's going to feel really good for yourself too. Because, and I know you guys know this, nothing feels better than doing the right thing for another person. You know it, they know it, nothing needs to be said. But when you are truly compassionate, when you are truly there, when you are your authentic healing self, that's when the magic happens. And that's when it feels really great to work in this profession and have that honor to bear witness to these other individuals, walk in their journey and alleviate their suffering in some small way. It matters. In the great words of Children's Healthcare of Atlanta, I got to work with them a while back. They came up with a vision statement for the project that we did. And their vision statement was, touch a life, impact a lifetime. And that's what we do every day in the good work in serving others. So I hope that you found this interesting. Let me know if you like this format. Reply down in the chats. I'll post the references that I used to support this discussion with you guys, and I'll see y'all tomorrow. Probably inside, because I hear it's going to be even colder. Take care and care well. Bye.